Hey guys, welcome back to the channel. Today I'm very excited because I have a gynecologist with us today and he's going to be answering all your juicy questions. So you want to stay tuned. Don't forget to subscribe down below and hit the like button if you find value in this video. And don't forget to hit that notification bell so you don't miss any of these awesome videos. Let's get into it. Something here that is very, actually I also want to talk about this deeply. Does an implant cause acne, rough texture? And there are so many questions about family planning. Very many people were, sharing their thoughts, saying maybe I tried this family planning but I still got pregnant. Can we just talk a bit about family planning? What are your thoughts about it? I feel like people share a lot of information on do this, but they don't share the side effects of family planning. Let's just dive into it a bit.
So, what does family planning mean? It means that you're going to have your desired number of children and when to have them.
Yes.
So you say I need 4 children and I'll have them spaced, say 2 to 3 years between each of them. You're in essence planning your family.
Okay.
There's also a concept of birth control.
Oh, okay.
You're not looking for a family, but you don't want to conceive. You don't want an unwanted or an unplanned pregnancy. So these two things almost are used interchangeably, but I wanted to clarify.
The difference.
Yes.
Okay. So about birth control.
Birth control methods. The person asks about the implant.
Yes.
So there are a number of family planning methods that we might not be able to exhaust in this session, but responding to the implant and acne, yes, to a certain extent.
Okay.
It could cause acne. The implant is the most effective family planning method. In a year, if 100 women were using the implant, less than 1 would conceive, meaning that it's very, very effective. You don't have to remember to put it, it's always there and it's working all the time. That's not the same for condoms, not the same for the pills, it's not the same for the injections that you might forget to forget to swallow. So it's basically the most effective. Even the intrauterine device, the copper, is just about 98% effective.
Many people have got pregnant with that thing.
Yes, it fails more than the implant.
Okay.
So what does the implant do? The implant has a hormone, progesterone, that is known to have side effects such as causing acne, causing vaginal dryness. So that might not go well with some people.
Yes.
It might also cause loss of sexual drive. Among other things. So I've seen women change methods because of those side effects that I've mentioned. But the funny thing is you can never know how you respond to a method
unless you try.
There is no blood type, there is no such thing as can you test my blood and see what method is good for me. It's not true.
Yeah.
So the important thing is to try the method. If it works for you, if you don't have any other medical conditions that might prevent you from using it, you can use the method because you'll see something like only 30% of people who are using it complain of dryness. Maybe 22% complain of acne. Meaning the other 88 or so are okay. They don't have any side effects. So the side effects of all these methods don't treat people the same. So don't listen to needs to the women in the salon, to your friends, to people who have gone through it.
It's unavoidable. You don't be that unlucky person who puts on all this weight, who gets all these
the weight gain, Sometimes people don't get the side effects. And the method works for them very well. Yes. So that's about the implant.
So it's hormonal, it may cause different hormonal changes in your body. So choose wisely.
Yes.
Yeah. Alright, someone asked, do men also need to see gynecologists? Why is it, only women going? What's this whole thing?
Yeah, so gynecologists in their training will also study about the male reproductive system.
Really?
To some extent.
Okay.
Especially things like reproduction in males, how sperms are formed, how they are transported, and some of the things that might affect those male reproductive organs. But there is another specialist who is called an andrologist.
Say that again?
Andrologist.
Andrologist.
Yes.
Okay.
Who is particularly trained to deal with the male reproductive system. You know, unlike women, the male reproductive system is also the urinary system.
Oh, yes, yes.
So there was also another type of doctor that's called a urologist, which comes from the urinary system.
Okay.
So a gynecologist is unlikely to attempt to treat a man who has, say, failure to pass urine, or who's having issues of bloody urine. There's another type of doctors that deal with that. But if a man is failing to have children, then a gynecologist will come in and can advise. But it's usually a multidisciplinary kind of approach to the males. Yes.
Are they there? I've never heard of them. Are they around?
They are there. Yes, they are there.
So,
andrologists, urologists, there are a number of them.
I know men, actually, many men I know, it's hard for them to go and see those people because men feel like, I don't know. But please, men, go and check. Yeah, all right. Okay. Someone says, I'm 7 weeks pregnant and I feel pain on both my sides. It's on and off. What could be the cause? And I remember I told this person, it's better to seek medical attention immediately because by the time I asked my gynecologist, I don't know, something could have happened. So what advice do you have for this person?
So she's 7 weeks pregnant. That's
Yes.
quite an early pregnancy. And she feels pain on either side. Yeah, it's very true. She needs to actually get in touch with her gynecologist because pain in the lower abdomen could be a sign that maybe she's having an infection, a urinary tract infection in pregnancy. She might be having an ectopic pregnancy, which is life-threatening. She may be having a threatened miscarriage about to happen.
Yeah. So
it's not something to take lightly if you have pain in pregnancy. But there are certain degrees of pain that are normal or not concerning. Some mild cramping here and there as the pregnancy establishes itself. As the baby implants into the uterus, there are some pains that you might experience in early pregnancy that might not be a need to worry about. But if it's very severe or if it starts to nag you and you have to take medicine for it, then you're better off getting to a gynecologist, an obstetrician.
Yes, someone needs to see you because they may not be able to tell you what the problem is without actually interfacing with you. So please go see your doctors if you have any pains that you don't understand. In pregnancy, especially. All right. Someone asks, if I have an infection, does my partner or spouse need to also take medicine, though with no symptoms? Because I think I've heard a lot about this, that you might have an infection, but your partner seems to be okay. What do you have to say about this?
That's a very common concern among women. It's first very important to differentiate. When you use the word infection, kind of generalize. Yeah. So, in fact, I've come across women or patients who come in and say they have an UTI. That's their opening statement. I have a UTI.
Self-diagnosis.
Yeah. So when you dig deep, you find that maybe they have vaginal itching, which is not a UTI. It's vaginitis. It's a fungal or vaginal thrush. It's a yeast infection. Those are different things, but not a UTI. So when you come to our office and you give us your complaints, we diagnose you. So if it's something like a urinary tract infection, it should be differentiated from an STI, which is a sexually transmitted infection. Most times, when we diagnose you with what women refer to as infections, that is vaginitis, like abnormal vaginal discharge, the white milky discharge, the itching, pain on passing urine, we don't consider treating your partner because these are not sexually, the organisms that cause these infections are not sexually transmitted. But it differs when, say, we find you with some sores on the genitals, which could be a sign of syphilis, a sign of herpes, simplex virus. Now these are STIs. We are crossing into the STI side. Maybe we find you with signs that we think are gonorrhea or chlamydia, which cause pelvic inflammatory disease. When we see that, we'll recommend that we treat your partner. And while you're in treatment, you either abstain or just have protected sex. Yeah, so STIs, when you come in and we think it's an STI, we diagnose it, we confirm it. The same applies to a man. If a man came in with symptoms suggestive of gonorrhea, we'll emphasize that they treat their partner or their sexual partners. The advantage that we have, the disadvantage we have here is we don't usually do contact tracing. In the Western world, in the UK, in the US, Australia, Canada, they have this, if someone walked in with an STI, they will ask them to list their sexual contacts in the past 2 to 3 months. And then they will give them a call, and they might not even say who gave them number. They'll just say one of your sexual partners or one of your partners has been diagnosed with an STI. Please come in and get medicine or come in and get screened. Which we don't have.
Why don't we do it here?
No, we are probably building capacity.
Okay.
As we approach middle income status.
All right. I think now you know. So unless it's an STI, you may need to call your partner to come in. Otherwise, yeast infection, your partner, you don't need that treatment. All right. Someone says, what causes extreme period pain? Even if I take painkillers, it doesn't help much.
Yeah.
What is that?
What causes that? So, extreme period pain in our language is dysmenorrhea.
Right.
Dysmenorrhea. Yes, that's painful menstruation.
Yeah.
So, I would like to divide it into 2 categories. There's something they call primary dysmenorrhea and secondary dysmenorrhea.
Yeah.
So primary dysmenorrhea, we can't actually establish any organic cause. There's nothing. You do a scan, everything looks very normal. But right from the start of your periods, say as a teenager, they are very painful.
Yes.
And you're bedridden, you have to go in for some shots, you have to swallow some medicine. Some people, they're actually sick during their menstruation.
Yes.
So research has been done, and it seems in some people, they produce an excess of certain chemicals. You know, when someone goes into their menstruation, they are bleeding.
Yes.
So the body tries to stop that bleeding, to prevent you from bleeding out. So there are certain chemicals, I would like to call them prostaglandins, eicosanoids, that are released. So these chemicals cause the uterus to contract.
Yes.
By contracting, it blocks the blood vessels that are bleeding. But in some people, the chemicals are produced in excess, and then the uterus will contract to a point of it cuts off its own oxygen supply and starts to cramp.
Yes.
You know, once it contracts so strongly, it will arrest the bleeding, but then there will be no more blood coming in to bring in oxygen. And it's just the same way you jog or you go to the gym and lift and then you cramp. Yes, so it's the same thing that happens down there.
Okay.
So in those people, when we give them medicine, we are trying to oppose those chemicals that are produced in excess, the prostaglandins. We are trying to oppose them such that we reduce the cramping, such that the uterus can have its blood supply moving on. But there's a risk that it might increase their bleeding, you know, something like that. But that's a certain type of people with primary dysmenorrhea. Secondary dysmenorrhea, they are gynecologic conditions like fibroids that develop within the course of one's reproductive life and can cause painful periods. So if someone has fibroids, one of their symptoms may be painful menstruation.
Yeah.
Such a person will offer some kind of help. There are other conditions. There's adenomyosis, there is endometriosis. I will not dig so deep into that. Maybe if a person has a history of pelvic infections, pelvic inflammatory disease, one of the things that they may suffer moving forward is painful cramps, painful menstruation. So we differentiate them that way and we manage them differently.
Alright, so if you have pain and you feel like it's too much,
Yes.
visit your gynecologist so they can assess which kind of treatment that you need. Right, wow, many questions here. Alright, we have another interesting question. Someone says, before I had a baby, I had my water. And I think she's talking about lubrication during sex.
Yes.
The water that people talk about. I have my water. But now I'm struggling. I seem to be struggling in that area. Is it just me or different ladies are facing the same issue? And then she puts a note that also she has an IUD. So is this the cause of having this dryness? Tell us more about this water.
Okay. Yes, I'm sure she's talking about sexual lubrication.
Yes.
So before going deep into the question, I would like to the myth that maybe the IUD may cause dryness, that's not true.
Not true.
It's not known to do that among its side effects. Vaginal dryness is not one of them. So understanding sexual lubrication, before answering her question, I would like to give us a brief on it.
Right.
So sexual lubrication occurs during sex. During arousal, you have an increased flow of blood to the vagina and the surrounding tissues, and that's why they swell during sexual intercourse. In these tissues are capillaries, which are small blood vessels. So when there is excess blood flow to this region, fluid, which we call the waters, is pushed out of these capillaries. You know, it's like blood is filtered. Blood has water or fluid component. So when there's high flow of blood in that area, the fluid component is pushed out.
Okay.
And that's what seeps through the vaginal walls to form the waters that people are talking about.
These waters?
Yes.
Yes.
There are also glands outside the vagina that have the same process and increased blood flow, secretion, and then this lubrication happens. So how does this start? Sex is in phases. It starts with arousal. Arousal is the idea, the text, the chat, that builds the mood.
Hyping it up.
And arousal can even start at the office. With a text to your wife or your girlfriend this evening.
It's
and already how many days is blown.
Yes.
So arousal is followed by stimulation because now arousal is your mind is getting aroused and in the mood. Then stimulation is tactile, kissing, stroking, and the like. etc. The massage, that is stimulation. Then that's followed by excitement. One gets into, after stimulation, there's the sexual act. After excitement builds up, you have an orgasm. And then you go into a phase of rest.
Yes.
For women, they might rest for a short time, but men tend to go into, need a little bit of longer time before they can go through the same process. So, for one to have adequate or comfortable sex or good lubrication, they need to have their mind in it.
Yes, true.
And then follow through the phases. So you must have this foreplay, you must have, don't rush into it.
Yes.
Don't rush into it. The gentlemen need to take their time. Don't rush into it. So that way they can, by taking their time, they're not being selfish, they're being selfless because the women need more time. While men can get it up in a few minutes and they are done in the next 3 minutes with no stress. For women, they need to be primed before they can enjoy it.
Like a flat iron. Takes
So all that aids in lubrication.
Okay.
But that's now the science. So how do we help the science? As a woman, you must be hydrated. You must drink a lot of fluids. You can't be taking soda or something. I mean, you're not hydrating enough and you expect down there to be lubricated well. So you must hydrate. You must be doing exercise. You must keep yourself fresh. Don't wear tight underwear. Don't sleep in underwear. You know, let everything be healthy, clean, and then that also will help you with this whole process. Now, for arousal, one of the things is the psychology of it.
Yeah.
For example, if a woman was abused, or is abused, or went through a traumatic experience, she might find herself failing to engage in sex. She can't get aroused. Then during sex, it's dry, it's rough. That might be because her mind is thinking about the traumatic experience.
Yeah.
Might be thinking about the promotion at work. Might be
the children.
Yes. You know, sex becomes like a job. I'm not excited. You know. So having had a child, her state of mind might have
changed a bit.
Maybe she had a child vaginally.
Yeah.
Maybe down there was got some tears and they had to repair, and she does not view herself as sexy anymore.
That's something.
That's going to play on your mind.
Yes.
You're not going to feel attractive. You're not going to enjoy sex, and that's going to affect your lubrication. So there's a lot of things that go into that.
So just is it true that some people have more water than others? Scientifically,
I think people are created differently.
Okay.
Yeah. So you might say that, but I may not be an expert.
Oh, yeah. Okay.
Yes.
There we have shifted.
Yeah.
Oh, all right. So I think that answers your question. Maybe go through the sex process, see where something is not right, and then also other mechanisms. Be hydrated, and do what you can to keep that area fresh. It may help with the water. Yeah. And then we're coming to our last question. Someone says, I'm 18 months pregnant and the cervix is already slightly open. What causes the cervix to open early? What can be done to close the cervix? More information about this would be really helpful. Someone is asking.
Yeah, so this goes into obstetrics and from gynaecology.
Oh, okay.
Yes, so for that person who asked that question, I believe she must have had a scan done during her antenatal care, and that was one of the things that was highlighted. The cervix is starting to open.
Okay, yeah.
And maybe for those who might not know, the cervix is what I would call the opening of the uterus. It's what should hold tight such that you can carry a baby. And during delivery or the birthing process, it opens.
Yes.
And lets the baby out. So the cervix, it has the cervix has a structure. For some people, it might be weak, based on the way it was created. Maybe they have a tissue disorder.
So it can be like natural, genetic.
Yes, genetic.
Yeah.
But it might also arise from some procedures that are done in the cervix. Maybe you've had evacuation, after miscarriage, maybe the weaken the cervix, such that in a subsequent pregnancy, you find that it's opening before your term or due to deliver. So, how we recommend, especially for women who have had a miscarriage in their second trimester, this miscarriage is described as painless opening of the cervix and maybe bleeding and water breaks. You don't feel any pain, you just feel your water broken and you're dripping, and then they tell you your cervix was open. This is between 5 months, 6 months, 4 months, 7 months, the mid-pregnancy period. So in a subsequent pregnancy, we are more keen and we follow you up and measure your cervix every time. You have serial ultrasound scan. And then when we notice it starting to open, we might put a stitch, which she asks about.
Yes.
Just like a thread that tries to close it and hold it strong, such that it can prolong your pregnancy to around 8 months. Some people, our goal is to cross 36 weeks. But if you've had this miscarriage twice, we don't wait to see it opening. We'll put the stitch the moment you're out of the first trimester. You know, after the first 3 months, we'll just plan and put a stitch such that we can allow your pregnancy to be prolonged. Yes, that is about it.
Wow. So many questions answered. I hope you found this useful. Thank you so much, Dr. Victor.
You're welcome.
You've given us so much information. I know we cannot exhaust all the questions, but some people may be wondering, where can I find you, Dr. Victor? And you know, to ask more or to dig deeper in all the things that you talked about. Tell us.
Okay, for starters, I'm in Kampala, and I practice at Kampala Hospital Limited in Kololo.
Okay.
Where I handle obstetrics and gynecology. But I also have an interest in practice at Neogenesis Fertility Center, especially dealing with fertility issues.
Fertility issues, yes.
People who are trying to conceive, maybe trying to have children, things like that. So
Yes.
those are the two places that can be found.
All right. Thank you so much for being here. We are honored to have you and we are grateful. So, if you found value in this video, you've learned a lot, be sure to let me know by hitting that like button. Also, don't forget to subscribe down, click the red button below, and also turn on your notification bell so that you don't miss any of these exciting videos. My name is Kusiima, and as always, I'm here to inspire.